Welcome back, everyone. For this lecture, we're going to review the anatomy and physiology of the airway. This lecture is intended for both EMTs, AEMTs, and paramedics, although some of the information may get a bit in depth for the EMT if you're just starting out. The primary component, or one of the primary components in caring for patients, is ensuring that they have a patent airway and can breathe adequately. When the ability to breathe is disrupted, oxygen delivery to tissues and cells can be compromised. And oxygen reaches the body tissues through the cells through the process of breathing, oxygenation, and circulation. So the airway and the respiratory system is extremely important for managing patients, both of a respiratory nature and those who may have other pathologies that may still involve respiratory compromise. Starting with the respiratory system, we divide the respiratory system in the upper and the lower airway. You can see each contains a significant number of structures, and we're going to break those down individually as we go through the lecture today. The respiratory system consists of all the structures that make up the airway and help us breathe, or a better term, ventilate. And we're going to introduce a couple of terms with this lecture today that are really important for us to be able to differentiate and discuss appropriately. One of those will be ventilate, or the process of ventilation. Another will be oxygenate, or the process of oxygenation. And the other will be respiration. That refers to the exchange of gases at the cellular level, or the process of cellular respiration. Okay. The airway is divided, as spoke earlier, between the upper and the lower airway system. So let's look at the upper airway first. The components of the upper airway, we're predominantly talking about the mouth, the nose, the oral cavity, the pharynx, and the larynx. This is a commonly mispronounced word. Pharynx, the Y is before the N, so it's pronounced pharynx, not pharynx, and larynx, not larynx, Larynx. Remember from our medical terminology discussions that pronunciation becomes really important. So in the upper airway, you can see on the image on the right-hand side of your screen, the nasopharynx is the area behind the nasal passage, and there is an opening there. The oropharynx is behind the oral cavity, and is the opening there into the airway. And the pharynx as a whole describes both the nasopharynx and the oropharynx in the process of moving into the trachea through the glottic opening. You can see the mouth here on the image, as well as the opening or the nares of the nose, opening up into the nasal passage, moving air into the nasopharynx. Below the oropharynx and what is called the hypopharynx, area just below the oropharynx, is where the epiglottis is. And once you move through the glottic opening, you move into the larynx. Talk about that in more depth and detail here shortly. The upper airway's function, their main function, is to warm, filter, and humidify air as it enters the body. The pharynx is a muscular tube extending from the nose and mouth to the level of the esophagus and the trachea. It's composed from top to bottom of the nasopharynx, the oropharynx, and the laryngopharynx, or hypopharynx. Looking at a front view of the back of the pharynx, you can see where there is an opening for the nasopharynx, the oropharynx, and where that moves down into the laryngopharynx. This filters out dust and small particles, and it warms and humidifies the air as it enters the body. The oropharynx is at the posterior portion of the oral cavity, and the epiglottis is superior to the larynx. We'll see a view here. You can see with a mouth open view, you can see the uvula, the tongue, and the gingiva, or gums, below the teeth. And as we move to a side profile view, you can see, if we're looking at the oropharynx, here is your opening in your mouth. Or os, or opening, is the medical term. And as air passes through the mouth, we move past the uvula and the tonsils into the oropharynx here. And you can see where that moves down into the laryngopharynx once it's past the epiglottis. The larynx itself contains several components that are of note. You have the thyroid ligament here, just below the hyoid bone. You have a laryngeal prominence, which you can feel or palpate on the neck. And that's just above the thyroid cartilage. I'll show you an image in a second where the thyroid is. You have the cricoid membrane. So for those of you looking at the paramedic route, when we talk about cricothyrotomy, this is the cricoid membrane we're looking at. And you have the cricoid cartilage just inferior to the cricothyroid membrane, which is also the first tracheal ring. The larynx is a complex structure, as we can see here, marked by independent cartilaginous structures, and it marks where the upper airway ends and the lower airway begins. Looking again at the larynx here, you can see the thyroid tissue just below the thyroid cartilage. The thyroid cartilage forms a V shape anteriorly toward the front of the body, and the cricoid cartilage is that first ring of the trachea. And the glottis is the area between the vocal cords in the trachea. Now let's look at the lower airway. The lower airway consists predominantly of the trachea, the bronchi, and the lungs. The trachea is the tube extending past the glottic opening, so just past the epiglottis. As air passes through the trachea, it divides into the left and right mainstem bronchus here. And once it moves from the left and right mainstem bronchi, it moves into the bronchioles and then into the alveolar tissue, which is where gas exchange takes place within the lungs. The trachea is the conduit for air entry into the lungs. It divides at a position called the carina, which is here. The carina moves each to left and right mainstem bronchi, and the bronchi are supported by cartilage. The bronchi then distribute the air further into bronchioles. It's the smaller tubes at the end of the bronchi here, and then into the small air sacs of the lungs, or the alveoli, the alveolar tissue. This is the parenchyma of the lungs, and the term parenchyma just refers to the functioning portion of an organ structure. So the alveoli is where the gas exchange takes place. All other structures are used to get gases, inhaled and exhaled gases, to and from that functional portion of the lungs. Another side view here, anterior view here, you can see the trachea. What's important to note here is there's a lot of organ structures that are located in and around the lung. The great vessels and other structures, heart included, and several nerves, can create some space constraints within the thoracic cavity. And we'll talk about how that can impact mechanisms of breathing with patient positioning and artificial ventilation in subsequent lectures. But it's important to note that contained within the thoracic cavity, not only do you have the lungs, but you have the heart and the great vessels as well. Here's an X-ray image of the mediastinum. This is the area that we're talking about, the middle of the chest. Okay, and you can see the lungs here are the dark shaded areas on each side. And the colored areas here, you have the heart with its visible four chambers, the vena cava, the aorta, pulmonary artery, and pulmonary vein, and how they move through the thoracic cavity. These are referred to as your great vessels. You can see the diaphragm at the bottom, and this diaphragm controls the pressure in the thoracic cavity to drive the normal process of ventilation. So let's talk for a quick moment about the physiology of breathing, or how ventilation works. We know that the process of ventilation, or breathing, is the air movement into and out of the lungs. Ventilation, as a natural process, is what's called negative pressure ventilation. It's driven by the diaphragm, and you can see the diaphragm during the at the start of the inspiration phase or at the end of the exhalation phase. okay, starts elevated at the top of the thoracic cavity. So as we have exhaled, the diaphragm has moved up and increased the pressure in the thoracic cavity, forcing air to move out of an area of high pressure into an area of lower pressure. During the inspiratory phase, the diaphragm flattens, increasing the volume of space in the thoracic cavity, forcing air to move from an environment of of higher pressure into the thoracic cavity, which is of lower pressure. This lower pressure is created by the increase in volume of the thoracic cavity as the diaphragm flattens. Okay? So during inspiration, the diaphragm flattens, the pressure inside the thoracic cavity goes down, and that causes air to move from an environment of high pressure to an environment of low pressure, thus filling the lungs. During the phase of expiration or exhalation, the diaphragm moves upward. It relaxes and moves upward, thus increasing the pressure, like you're squeezing on a balloon, okay? Increasing the pressure in the thoracic cavity, forcing air out of the lungs from an area of high pressure to an area of low pressure or lower pressure. Okay? Inhalation brings in oxygen, exhalation helps move out carbon dioxide and other waste products. When we use artificial ventilation, it's important to note that we change this process from the normal physiologic process of negative pressure ventilation to the term positive pressure ventilation. So we're forcing air in and subsequently increasing the pressure in the thoracic cavity, and then it returns to match the atmospheric pressure when we're not ventilating that patient with positive pressure ventilation. There are some physiologic implications to this that we'll talk more about in patient management. Okay. It's important to understand the normal physiologic process of ventilation is negative pressure. The diaphragm contracts, it increases the volume of the thoracic cavity, thus causing air to rush in. The diaphragm relaxes, moves upward, increasing the pressure in the thoracic cavity, air leaves. When we ventilate a patient with positive pressure ventilation, we're increasing the pressure of the lungs to force air in, not reducing the pressure like the normal physiologic process. Three important terms that you need to be able to take away from this discussion. One, ventilation is the act of moving air into and out of the lungs. Oxygenation is the process of loading oxygen molecules onto hemoglobin in the bloodstream. This is the exchange of oxygen that occurs at the capillary and alveolar junction within the lungs, moving oxygen onto the hemoglobin after it's been delivered via ventilation. Respiration is the actual exchange of oxygen and carbon dioxide at the tissue. Okay? Respiration, cellular respiration, is that exchange of gases.